Good morning. Thank you for having me back. I will try to keep this as brief as possible, knowing that you have a very long agenda. I have tried to shorten this as much as possible. I'm going to give a brief update of what our status is, give you some vaccination statistics, and then I have a couple of requests from the county commissioners. One will be easy, one will be a good bit more challenging, but we'll go ahead and get through this as quickly as possible. As many of you are aware, our COVID-19 metrics are up significantly since June 2021. Kent County, along with Maryland and the rest of the United States, are experiencing the fifth wave of COVID-19 in our community. The surge is being driven by the highly infectious Delta variant. That is a mutation of the original COVID-19 virus that has adaptive advantage and is transmitted a lot more easily, and data suggests at this point that it can lead to a more severe form of illness. The other update is, as of July 1st, Governor Hogan lifted most of the executive orders and mandates that were in place for the public health emergency. As a result, the health department has transitioned into a post-emergency recovery footing. We have worked very hard to reopen our programs, to get all of our employees back into the building, providing customer service in person as much as possible. And as a result, it is much more difficult now with all of those programs fully operating to mount the COVID response. The mandates and restrictions that were really part of the public health emergency have been transitioned to CDC recommendations. At this point, the health department is, we don't have direct authority without the Kent County Board of Health, which involves you three and the health officer, to issue mandates. And really what we're doing at this point is issuing recommendations and encouraging people to follow those recommendations. It's their choice whether to follow them or to implement them or to ignore them. And certainly as the county's lead public health official, I encourage everyone to follow those recommendations as much as possible. One of the big developments really that has happened since July 1st is that the hospital in town, University of Maryland Shore Regional Health, no longer has intensive care unit beds. All of they have been shut down and those services have been moved to Easton, and that's all part of the rural, changing the classification of that hospital to a rural access hospital. Fortunately at this point, as a result of the fifth wave, our hospital capacity statewide and locally, they have been able to absorb the current cases. We're not, right now, as far as I understand, in any type of crisis setting related to inpatient beds, ICU beds, but that too can change. In an effort to simplify, and I'm going to move on to the next slide number 3 here. Instead of presenting a whole bunch of data and graphs, I have made an effort to simplify things, and so has the Centers for Disease Control. Right now they're tracking case activities in every county and territory in our country, and you can go and they have 4 statuses: high, substantial, moderate, low, or no data at all. So really there are 4 classifications, and what's important to recognize as of yesterday at least, the status in Kent County of community transmission for COVID-19 is high. That is, we went from substantial to high 2 weeks ago, and essentially the recommendations when our community is in a high rate of community transmission. We encourage everyone to wear masks in indoor public spaces, regardless of your vaccine status. Please get vaccinated if possible. Wash your hands, social distance, monitor for symptoms, and get tested if you have symptoms. On the next slide, I present the general data for Kent County in the last, for today and also for the last month. The important thing that is on this particular slide, is the weekly increase in number of cases that you can see as we move from late July into the middle of August. Our numbers of cases have increased substantially, and that is consistent with the spread of the Delta variant, across our state and across the country. It is highly transmissible, and we are seeing those cases not only in unvaccinated individuals, we are seeing it in folks who are vaccinated. At this point, of all the positive cases since the inception of the pandemic, we have had 23 cases of breakthrough cases. They're cases who have been confirmed in fully vaccinated individuals. The good news is that if you are fully vaccinated and you become infected, the likelihood of having severe illness or disease is significantly diminished. That is, folks who are vaccinated can get infected and can pass that along to other community members, but the likelihood of needing to be hospitalized or potentially dying is significantly reduced if folks are vaccinated. Vaccination is the tool that we are going to use to get out of this pandemic. And it is vitally important that as many community members get vaccinated as are eligible. This is our one tool that is going to help us combat this pandemic and move back to normalcy. So the next couple of slides I'm presenting the vaccination status of the county. I have broken it down pretty much. The first slide here on page 6 is the overall vaccination rate for everybody who's eligible. At this point, we have about 61% of our population is fully vaccinated, and about 66.4% have received at least the first dose. So we know that even getting one dose of the vaccine does provide some effect. We encourage you to get everybody to get fully vaccinated. But at this point, the easiest thing to remember for a community-wide metric, about 2/3 of our population has been vaccinated. The next several slides, I break out the overall vaccination rates into specific demographic populations. The first one, on page 7, illustrates vaccination rates for our 65 and over group. We're doing very well in that population. About 87% of our 65 and older folks have been fully vaccinated. This puts us about, when you compare county to county, this puts us in 6 out of the 12 counties. And for the overall rate, I didn't mention that. For Kent County, if you look at our fully vaccinated rate, that puts us, right in the middle of all the other counties. We're ranked 12th out of 24. For our 65 and over group, we are, compared to our other counties, we were ranked 6 out of 24, which is good. On slide number 8, unfortunately, this is our youth vaccination rates. This is those who are between the age of 12 and 17. We are not doing so well in that group. We have about 31% of those who are eligible who have received their first dose, and 24% have been fully vaccinated. So if you look at the numbers for fully vaccinated at this point, we have 351 individuals between the age of 12 and 17 who've been vaccinated. You combine that, you consider that in Kent County we have approximately 2,000 school-age kids. 2,000 school-age kids, and 351 of them have been vaccinated. That comes out to about 17.5% of our school-age kids. Now, granted that those who are under the age of 12 can't get vaccinated. So, we're going to have, when schools open, in the near future, we're going to have COVID in the schools. That is going to be a reality. And, I take this opportunity to applaud Dr. Couch and the Board of Education for, making the difficult decision to mandate schools in the classrooms. I think that, along with everything else that they're doing, is going to make a significant difference to keep our kids in school. The health department wants to keep the kids in school. Education and the deficits that we're trying to overcome, it is very important, to get them there and have them receive the educational activities that they're having. But, we still have work to do, to get our kids vaccinated. So, in the last couple of days, there have been some COVID-19 vaccine developments. Last week, booster vaccines, that would be a third dose, are now approved for those who have weakened immune systems. We are expecting booster vaccines for the general public to be approved as early as the middle of September. So right now we have about 11,000 people who have been fully vaccinated. The health department at this point is the vaccination provider of choice for the majority of the county. We're going to have to mount a relatively significant vaccine effort when boosters are, announced in likely the middle to end of next month. So that's going to be a significant effort on our behalf, and that's going to lead to one of the requests that it's both of the requests I have actually. So booster vaccines are for those who have received Moderna or Pfizer products. Data for the Johnson & Johnson product has not been completely collected and determined, but in all likelihood that those who have received that product will need a booster as well. What we do know is that the boosters will need to occur no less than 8 months after the second dose. So we're looking, as we project out to the demand, we're looking at, in all likelihood for the county, October, November, and December is going to be our high volume months. And then if boosters are needed 8 months thereafter, we will need to have the ability to do that. But one vaccination a wave at a time, please. We also have flu shots that are coming up in the fall. That is typically one of our big efforts. So we have a lot of vaccinating to do in the next 4 to 6 months. Other developments related to COVID-19 vaccinations. Yesterday, the FDA issued full authorization for Pfizer. That's good news. I think that we had many people who were concerned about getting vaccinated until it was fully vetted by the FDA. That product is fully approved, and I anticipate the Moderna product to be, receive the same level of approval sometime in the next 30 days. One of the big developments out of the governor's office and also out of the White House, nursing homes and state-operated facilities will need to have their staff vaccinated, or if the staff have not been vaccinated, they will need to be tested weekly. And in all likelihood, the testing activity those folks will come to the health department for the testing that is provided and paid for by the Maryland Department of Health. So, how are we doing vaccinations? Right now the health department offers COVID vaccinations every Thursday by appointment. We offer all 3 products. We ask individuals who want to get vaccinated, please give us a call or visit our website to go through the interactive scheduling application, and you can make your own appointment. It doesn't necessarily have to be at the health department. Our pharmacies are offering vaccines, and a few of our providers are offering vaccines. We just ask that if you come in with anyone under the age of 18, they need to be accompanied by a parent or guardian. Testing services, as our metrics go up, the demand for testing has really skyrocketed, and we have really been wrestling with how we can meet that demand. We have been having a significant staffing issues being able to make that happen. And we're working with a couple of, we're working with the state of Maryland. We're also working with the public schools potentially for a, some type of testing service for our school population. But we're struggling. We are now offering testing on Mondays by appointment, and just yesterday, we tested 80 individuals in a 4-hour period. And as mandatory testing for those who are not vaccinated goes into effect September 1st, we expect that those numbers to go up as well. So as I transition to slide number 12, I have the first request I have involves this is the easy one. In all likelihood, we're going to need to use the community center again for our booster vaccination activities. We think that we can do most of our vaccination activities in the conference room and the lobby, and we have been in discussions with Myra about what the availability is and what they could possibly do. But I think that if we're looking at delivering, in the neighborhood of 8,000 to 9,000 booster doses, that we are not going to be able to do it at the health department in the space that we have. We're going to need to have sort of a larger clinic space. The timing of that really depends on FDA guidance, but we're anticipating the largest volume to happen in October, November, and December, and that corresponds with vaccination events that happen in February, March, and April. So the second request is the harder request. The health department is looking to increase our staffing for vaccination and testing. We are struggling on that front now that all of our other programs have gone back into full swing. We don't have the ability to reassign folks from programs that have been sidelined because of closures or other issues. So we're in the process of applying for a USDA grant to support enhanced COVID response. The USDA will provide 35% of the funding if the county matches 65% of the funding. We're asking, I'm asking at this point to look at two full-time registered nurses and 2 full-time nursing assistants. That translates into, a request from the commissioners for about $227,000. We will get $122,000 from the USDA if it goes through, for a total request of $350,000. I think that's a lot of money, but recognize that in Kent County, as far as the COVID response, especially when it comes to vaccinations and testing, the Kent County Health Department is the provider of choice. Many of our healthcare providers and labs are not interested in doing vaccinations or doing the testing. In fact, we have many people who have to, if you have symptoms and you want to go see your physician, the physician is requiring, many of the practices requiring that you have a negative COVID test before you can walk in the door of the physician's office. And, is the physician's office providing the testing? No, they're sending it to the health department. We have no problem doing that as long as the state is covering the cost of the testing. And from what I understand, that will be true for the near future. We were ready to be done with COVID. COVID is not done with us yet. We still have work to do, and we're up to the task. It's been a long 18 months. We very urgently want to get back to a sense of normalcy, and at this point, I think that it's going to take a concerted effort from the health department and a little bit more staffing to make that happen. And with that, if you have any questions for me.
Is this funding for the vaccination and testing, or?
Correct.
Okay, so it would be that.
And that is it going to be a yearly thing. As long as the virus is here, these people, we will continue to.
Yes, this is a time-limited grant. I think it's for 2 years. So we're interested in engaging your support for, it coincides, the USDA funding coincides with the ARP funding that came through for other federal agencies and the counties. That time frame, I think, will be what this grant coincides with.
I guess what I was asking, this 227 that you're asking us for, is that for a 12-month period?
Correct.
So, and we're envisioning doing it 2 years.
Yes.
So that would be 227 this year, another 227 next year.
Correct.
Does the ARP money handle that at all?
So as of right now, with the interim final rule on the American Rescue Plan Act, that money cannot be used as a match for federal dollars. So I'm assuming that would fall into this category if it's a USDA match. But the final rule is due to come out in early September, and that'll be the ultimate guidance that we'll have. As of right now, everything that they've opened up under the interim final rule will continue to be opened up in the final rule, but they're also going to open it up a little bit wider. So nothing that they've okayed will come out, but they will okay other things. And this is one of the items that they're looking at to have approved.
When do you need this money by?
Well, as soon as possible, but that's we will take it if, we're going to have a meeting with the USDA representative on the 31st about our grant application. I'm not sure, what the timing and submission date is thereafter. I think it's probably within 2 weeks.
So you have to have a commitment from the county for USDA before they will say they will do it, or?
Yes.
You understand what I'm saying?
Yes.
Honestly, I don't have a problem. I don't see how we can say no
Well,
to that, but
yeah.
I would like some time to figure out where we're going to take the money from, because depending on where we pull it from depends on maybe whether we get reimbursed down the road. I don't know if that's true.
Yeah, well, I don't think it's a question that we need to do it. I would certainly think that final ruling on that ARPA money is going to allow that money to be used for this. I mean, if it doesn't, then you question how serious is the federal government on this. But either way, I don't know what you think, Ronnie, but I think we've got to.
I'm not going to say no to it, I can
Right.
assure you, and I'm prepared to make a motion this morning to go forward with that, and we'll worry about where we get the money at the end. I mean, we have spent, and the federal government, the state, and the county, we have spent a ton of money, all revolving around this COVID-19, and this probably is one of the more important things that's been funded out of that whole ton of money. So, I mean, how do you get to this point and then say no? I won't be a part of that. So I will make a motion that we approve the request, and we'll worry about where the money comes later. And we would hope that people who are controlling all of this money will see the wisdom in this request.
Yes, and unfortunately, the original CARES funding was, could potentially have covered this, but we were under the impression that had to be spent by the 31st of last year.
When we were doing the big vaccination program out to the community center, were a lot of those people given the vaccines, were they a lot of those volunteers, or were they?
We had a lot of volunteers. We also had, we also have about 5 or 6 contractual folks who were working to, who were working nurses to, and most of them were either retired or used to work for the health department. And what we have found is that many of the folks are not interested in doing testing. The testing is very difficult because our contractual staff are they're on the older end of the demographic. It's a higher risk situation in that potentially you're working with folks who are actively symptomatic, and they have they've said, listen, we'll do vaccinations, but we won't do testing. And one of the things that the state and the federal government is looking at doing is building a more robust public health infrastructure. And the way we do that is with full-time merit employees who are working in the health department, and who when they sign up for the position understand that this is part of the job. We want to do the vaccinations, and at some point, we're hoping that vaccinations will move back into the medical, the standard medical sphere, just like your tetanus and your chicken pox and all that other stuff. But if we're looking at boosters every 8 months, we're going to need more robust staff. Right now we have 3 communicable disease nurses, to handle testing, contact tracing, and vaccination. And that's we're scrambling to make that work.
So before, last year, you were giving vaccinations twice a week, once a week?
We were giving vaccinations, by appointment. We found our vaccination before the whole COVID. Are you talking about before COVID?
I'm just talking about during COVID, like you already had the health out in Morton, you were open 2 days a week.
Correct. We were doing that 2 days a week, and we were able to handle, 200 to 500.
And you were doing testing 2 other days during the week, or?
We were doing testing
One other day a week. So will these 4 positions allow you to do more 5 days a week, or?
Yes, we want to do testing 5 days a week because the community, there's, I get a lot of calls, well, when can I come in for a test? And if you're symptomatic, timely test results are very important. But when you have 3 communicable disease nurses, 2 of which are on maternity leave right now, so we have 1 full-time person who is doing vaccination, testing, and contact tracing for the entire health department. We're supplementing it with contractual folks, but we're very thin, and we need some help.
And look at this as this pretty. This is a very important time of the year, especially as Dr. Couch is here. We're talking about sending kids back to school, which I think I'm all for that, and I think that the kids do need to go back to school. But Dr. Couch, will you have some type of? I'm just curious if there is any kind of testing that will take place. And maybe, I don't want to put you on the spot, but I'm just curious. We're having a conversation about this, and I was just wondering if there was anything additional that was going to take place at the school, involving the school.
So
Bill knows about it.
Well,
Okay.
One of the things that we're working closely with Dr. Couch and the Board of Education, and one of the things that we were looking at implementing a diagnostic testing program for all 5 schools, and that would potentially, one of the limiting factors that we have in our schools is space to do this, and so we have a testing center that we rent, all the time, that's only used 1 day a week. And what we're interested in doing is expanding the staffing in that testing center, and using some of the resources that the school system can, and use that location for for school-based testing. So essentially, if you have somebody who's symptomatic and needs to be, taken home from school, we can send them to the testing center in Chestertown and get them tested that day. And I think that's going to be that is going to be our best effort in trying to be able to address those kids, because it's not only when you're symptomatic that you need a test, but if you are exposed and you need to quarantine, part of the release from quarantine standards is having a negative test after day 5, day 5 to day 7, and that's going to be an important part of getting the kids back into school.
Are the school nurses that are already on the payroll, or are they able to give testing?
The difficulty with that is the space. One of the things you need to have. Our school nurses are very busy, just handling their day-to-day routine, and the bandwidth to be able to do the testing is that's really more than they can do, because each testing event, by the time you collect the specimen, package the specimen, and document everything, it's about 15 to 20 minutes a test if you're doing one at a time arrangement like that, and that requires putting on all the PPE. And I think one of the easiest ways to handle that is to have a separate, dedicated testing site for our school-based community, where that's all we do all day long, 5 days a week, and we very much want to get to that point. We're exploring all of our options on how we can potentially do that. More staffing would certainly help, and we're also looking at resources available from the Maryland Department of Health. They may be able to offer recurring testing services, and the Maryland Department of Education and the Maryland Department of Health has a pot of money that has been set aside specifically for school testing. So we're actively working that angle, and we're trying to figure out at this point how we're going to implement that.
Well, thank you for that. I mean, I know there's a lot of people interested in this starting of school and what's being done to safeguard everything, so good for you. But if we need to put that in a motion, I'll make a motion that we support Dr. Webb's request, financial request.
Well, you put that in the motion, didn't you?
Okay.
I mean,
Well,
it's
it wasn't really official, but
Oh, okay.
I'm just saying that the request for $227,000 for this year for the hiring of two
nurses and 2 nursing assistants.
2 nursing assistants, and two nurses and 2 nursing assistants.
Second.
Is there any other discussion? If not, all those in favor say aye. Aye. So let's
Thank you.
proceed with that. I do have another question. What is the status in Delaware, since we border Delaware, and also southeastern Pennsylvania, because we have a lot of, particularly this time of year, and we have had in the past month boaters, coming down, fishing, that type of thing. Are they in a high?
Yes,
status?
when I check the general status of our, not just the state of Maryland, but the general community, the majority of the country at this point is in a high status, and one of the challenges that we have, as the health department, as public leaders, that a governor declared emergency or mandates is that is very, we're not going to see that. At least my opinion is that it's unlikely we're going to see additional broad community mandates and restrictions. That's really only going to happen if our healthcare system really gets into a jam like Alabama or Louisiana, where they have no ICU beds, then something might be forthcoming. As we move forward, it's going to be about living a healthy life in a COVID world, and we encourage everybody to monitor the status and get vaccinated. The fastest way that we can get past this is to get vaccinated. But how can we live and be open for business and have good educational opportunities for our children? How can we live a normal life in a COVID world? And it's going to be a challenge. Every day we're trying to figure out the best way to do these things. And Kent County has always has been a leader in our response and the metrics that we have. I think that I'm grateful to live here. I'm grateful for all of the citizens of Kent County, and we're gonna get through this. The fifth wave is exactly that. We have gotten through the 4 others. We will get through this one, and how can we do it with as little disruption as possible to the community.
One final question. When you talk about hiring these 2 nurses and 2 nursing assistants, how available do you think those kind of people are in today's climate when they're hiring everybody's got hiring signs out? I go into those nursing homes once in a while. There's bonuses. They're offering $5,000 bonuses for RNs to come to work at nursing facilities. I'm just curious how much trouble you think you're going to have finding these people.
We have had challenges. I can tell you that we have recently recruited for a number of nursing positions, and what we have found is almost universally, our prospective applicants are very interested in a salary level that far exceeds what the health department can pay. And when I remind the folks that, our most successful candidates are local folks, and I remind people if you don't have to drive an hour to get to work, and you get to to be locally in a community with the people and respect, and the health department with a full-time merit position that has the benefit package, the leave accrual, and the pension, that presents a very powerful incentive for our folks to take it on. And we absolutely have difficulty finding nurses, but I think that the desire for many nurses, we have found that positions where you're working 9 to 5, Monday through Friday, are much more attractive than those in a 24/7 facility, and working in an outpatient setting is more attractive than working with folks who are acutely ill that require dealing with body fluids and heavy lifting. It is we have a lot to offer, and we're trying to sell it as much as possible.
Okay, thank you, Mr. Webb. Thank you once again for everything that you are doing with your staff. Mr. Darrell, do you have anything you want to add?
No, sir, just that we've started our EOC calls again. We're doing them monthly for now and monitoring in case we need to make them more frequent.
All right, thank you to both of you.